India is finally writing the rule book on fat. For the first time ever, the country is drafting national guidelines to screen, to prevent, and to treat obesity. Obesity, which is, as we know, a silent epidemic that's now overtaken both our cities and our villages, both adults and children. From redefining how we diagnose obesity to setting strict boundaries on weight loss drugs like GLP-1, this playbook could reshape everything from school nutrition policies to who qualifies for bariatric surgery. Here's what's coming and why it matters.
Obesity is no longer a silent issue in India. It is now a full-blown public health emergency. More than 1 in 4 Indian adults is classified as overweight or obese. That number has tripled in just over a decade, cutting across age groups, income levels, and geographies. Even among children, the trend is rising at an alarming pace. But these statistics we already know. Question is, what are we doing about it? Now, for the first time, India is preparing national obesity guidelines, a long overdue roadmap for screening, prevention, and treatment. Experts from the Indian Council of Medical Research, the Health Ministry, and specialists in endocrinology and bariatric surgery, nutrition, and public health have started work on what could be a turning point in how India addresses its weight crisis. Obesity in India has become both common and deeply misunderstood. According to recent data, 24% women are overweight or obese, 23% men are overweight or obese. Children under 5, obesity rose from 2.1% to 3.4%. And it's not just about weight on a scale. You would know that by now if you have been watching this space. Many Indians with a normal BMI still carry excess abdominal fat, which is a strong predictor of diabetes, hypertension, cardiovascular disease, and even some cancers. To understand this better, let's look at the obesity map of India. Some states are seeing particularly high prevalence. Kerala 65.4%, Punjab 62.5%, Delhi 59%, Tamil Nadu 57.9%, states like Jharkhand 23.9% and Madhya Pradesh 24.9% report lower obesity levels. Risk factors include age, urban lifestyle, higher income, and dietary habits. Obesity rates are also notably higher among certain communities, including Sikhs, perhaps due to eating habits. Interestingly, the World Health Organization recommends population-level interventions such as sugar taxes, front-of-pack food labeling, and restrictions on junk food marketing, especially to children. India's upcoming guidelines will likely draw on these global frameworks while adapting them to local healthcare and cultural contexts. So what will India's new guideline cover? We are learning they are expected to include early detection tools beyond BMI, including waist circumference and metabolic risk markers, population-level prevention strategies in school, workplaces, and urban spaces, lifestyle modification protocols focused on diet, physical activity, sleep, and stress, medical therapies, and this is critical, including modern drugs like GLP-1 and GIP receptor agonists that mimic gut hormones to reduce hunger and slow digestion. Updated bariatric surgery criteria for individuals with morbid obesity. Yes, GLP-1 drugs are likely to find mention in the obesity guidelines. The new guidelines are expected to include strict protocols to regulate misuse, when, how, and under whose supervision these drugs can be used.
Obesity, remember, is now one of the strongest drivers of non-communicable diseases in India, including diabetes, hypertension, fatty liver, and cardiovascular disease. Some cancers have also been linked to excess body fat, especially in the abdominal area. India, however, remember, is facing a dual burden: widespread undernutrition in subsections of the society and increasing overnutrition and obesity in the others. For years, there have been no unified national approach to deal with the latter. This new guideline could change that. Of course, the key is going to be in adoption and its implementation across the country. Sonal Mehrotra Kapoor for India Today. So it's a good guideline, much needed guideline that is now underway. We still don't know the date at which it will come out and what exactly it will have. These were some of the things that our reporter Milan actually picked up with her sources as well. But you know, when it comes to obesity in India, it's been a day of contrasts. Why? Because on one hand, we are setting to release the first ever national obesity guideline, a much needed framework, like I said, that could, by the way, include the use of GLP-1 drugs to treat obesity. That will be the first of its kind. But on the other hand, the Indian Medical Association has sounded alarm over their rampant misuse, warning that any doctor, including a dermat, a physio, even Ayurveda practitioners, are now prescribing GLP-1 drugs. And this will lead to massive misuse, and without any proper supervision or expertise, this could be very, very dangerous. GLP-1 is now, as we know, or perhaps has been the experience even in the West, is turning out to be a double-edged sword. Huge medical promise on one side, serious consequences if misused on the other. Milan now joins us more on this story as well. Milan, like I said, it's a day of contrast. On one hand, government is recognizing GLP-1 drug, all discussing whether or not it should be included into the guideline. On the other, doctors are saying, hold on, let's limit the use first. Let's figure out what is the best way to roll out GLP-1 drugs.
Absolutely, Sonal, because GLP-1 drugs essentially were earlier part of the type 2 diabetes and type 1 diabetes guidelines that had been issued by the ICMR. Now, the national obesity guidelines, need of the hour, of course, are now being worked on by the Indian government. And certainly this is after Prime Minister Narendra Modi has also mentioned that obesity is becoming a silent killer and silent crisis in the country. And when you talk about misuse, of course, the IMA doctors, they're suggesting that the Ayurveda practitioners, etc., are prescribing it. It should not be prescribed by anyone other than an expert endocrinologist. And on the other hand, when you talk about the contrast, of course, the bariatric section of doctors who reduce weight, with surgeries are all obviously going to be against the rampant misuse of these drugs, because once the generics enter the market, and we are soon perhaps going to see that happening once the patent for semaglutide expires, in some countries at least, what's going to be the impact on India is also a larger question, because right now GLP drugs are not in the reach affordability level of everyone, but that's going to happen pretty soon. And then of course it should not be available over the counter and should be prescribed, but we're also looking at side effects and people have to be educated on that. So therefore the national obesity guidelines will pave the way for that. But this was just the first meeting, and of course my source tells me there's going to be more discussion on the weight loss drugs as well. Sonal? All
right, so we are waiting for that, all eyes on that as well, as we wait to see what is the formal guideline that the country will actually come out with. We also have some guests joining us on the same story. We've got Chandrakant Laheria, doctor joining us, founder and director for the Foundation of People-Centric Health Systems, also Dr. Anupam Biswas, senior consultant endocrinologist at Fortis Hospital. Dr. Laheria, thank you so much for being with us today. Like I said, it's quite, I don't know how to wrap my head around this. Are we moving ahead of the curve here? In the West, when it comes to GLP-1, there is perhaps the most expensive lawsuit the pharma industry has ever faced that has been filed now. Some 1,500 people have come together and said that Ozempic led to blindness, and that, case is being heard. On the other, the guidelines here in India being formed while we are trying to treat obesity. GLP-1, do you think it should be included or excluded till the time we understand the long-term impact? Dr. Laheria, you're on mute. If you could unmute yourself, please.
One thing which we need to remember that the GLP-1 receptor agonists, the new drugs are very effective in reducing weight.
Yeah.
But we also need to remember that these drugs are not for everyone. The qualified medical provider will guide that who should receive the drugs and what is the approach. And then the second part we need to remember is that no matter which drug, whatever drug we take, paracetamol, also a very common drug, but it can cause side effects. So even GLP-1 receptor agonists can cause side effect. thing is that one of the big contribution, in my opinion, of these drugs availability in Indian market is that the entire dialogue on obesity and overweight in India has started. But we need to be cautious, and that's why guidelines are required. That the GLP-1 receptor agonists or weight reduction drugs are not the only solution.
Right.
No matter what, in every case, the lifestyle modification, dietary modification, or physical activity are the first line. And along with that, these drugs, GLP-1 receptor agonists, are the solution. That's why the guidelines will be very useful. And then fourth point is, I was hearing the feature which was run before this, that we know that it's not the double burden, but India has a triple burden of malnutrition, which essentially means undernutrition, overnutrition, and
Yeah.
micronutrition deficiency.
Yes.
If you go to like any place, there are iodine deficiency, vitamin D deficiency, other micronutrient deficiencies. So we need to ensure to the people that they have a right weight, not the excess weight. And finally, coming to GLP-1 RA, definitely there is a need for more regulation, better control. Definitely, the people who are not qualified to prescribe, essentially the other pathies should not be prescribing these medication.
So
this
what
is
should be, so let me try and understand this, Dr. Laheria. Dr. Anupam Biswas also with us. Dr. Biswas, if you could come in on this, what should be the ideal way to approach and ensure that misuse does not happen? I was reading up that in certain countries, what they've done is they've taken the rights to prescribe GLP-1 drugs and limited it to very specific doctors. Doctors who are endocrinologists and perhaps doctors in a few more fields. They have limited and they prohibited any other form of doctor to even prescribe this drug. Is that a way that India can sort of go in?
Yes, so that is a very important question, because if we misuse the drug, obviously there are going to be consequences. So it's very important for us to know who can prescribe these drugs, so that only patients who require these drugs should benefit from it. So it should not be prescribed over the counter. It should be prescribed by either a certified endocrinologist or a physician who has worked in this field for a longer time. And even if you look at the European guidelines, they have restricted it to endocrinologists who can prescribe this drug.
Yes.
There are certain side effects of this drug also, but we have been using GLP-1 receptor analog for a very long time, and we have seen very good results in our type 2 diabetes patients and even in our obesity patients. But again, it is very important to screen, and or after screening, we have to evaluate who are the patients who require these drugs. And based on the guidelines, we would recommend these drugs to these patients.
Right, but you know, Dr. Laheria, you and I have spoken about this several times now. And every time I hear a doctor saying it should be done this way, it should be done this way. But off camera, a lot of endocrinologists now tell me that the misuse is already happening. Every second person coming into clinics today does not need the GLP-1 but is asking for GLP-1. It of course doesn't help when Serena Williams, Oprah Winfrey actually endorse it. So clearly we can't leave it for good sort of judgment to sit in on people. We need clear guidelines, we need clear guardrails. So we can't perhaps wait for just these guidelines. There should be proper rules that are sort of rolled out by the health ministry even before.
I think I cannot agree more on this topic, because there is a lot of surrogate marketing going on for the drugs, and which is, in my opinion, worrying. Of course, any medication, especially when a new medication, should be prescribed by a qualified provider who is trained in the area, endocrinologist, internal medicine specialist, even an MBBS physician who is trained. So the point which Dr. Biswas mentioned, that a person should be qualified to prescribe this medication. And second dimension of this is that the people, even before the drugs became available in Indian market, were buying or purchasing over the counter bringing from other countries. So there is a need to bring awareness in population that do not use these drugs for a cosmetic reason or without prescription or qualified medical providers. And that's where these guidelines would be useful.
Got it. I have last few minutes, Dr. Laheria, and I just want to quickly understand this from you. Like I said, we can't hope, we are doing everything in our capacity as media houses to ensure that the right information goes out. We are doing a health show every day. and telling people almost on alternate day basis about obesity drugs, the pros and cons, the red lines, the Lakshman Rekha that you must not follow, you must not cross, etc. But if you had to tell the government or give the government one advice on how to roll this out in the better manner, what would that be?
I think the best approach would be what you had shown in your feature earlier, that we should remember, if we keep talking about GLP-1 receptor agonists, then it sends a message that these are the only solutions. So whenever we have to talk about, whenever government guidelines need to be formed, they have to focus upon the childhood obesity, school-based intervention. They need to focus upon how to reduce the weight, the lifestyle modification, physical activity. They need to have attention on the training of the medical provider or doctors in this area and the better regulation of these aspects. And more importantly, one of the key area, we need to work upon the root cause of obesity. People need to be made aware about what is the overweight obesity. Like that is the starting point. People do not know whether they are overweight, obese, and then it's only when they cross the BMI, body mass index, which is a crude indicator well beyond the limit, then only they become aware. If we raise awareness, the moment people are becoming overweight, they can implement that lifestyle modifications. There are many things to be done, and the GLP-1 receptor agonist or a surgery are not the solution. Rather, they are the last thought. And the guidelines need to focus upon from the prevention, health promotion, treatment, and then of course use of these medications.
I think my worry here is that of course GLP-1 is much more powerful, but a parallel can be drawn with antibiotics. There's an entire generation of kids who have grown up popping antibiotics which are available over the counter, and they're all resistant now to different viruses. The worry here is that this is what it's going to be. So we need clear guidelines, and hopefully the health ministry is listening in to what needs to be done now, not wait for guidelines to be formed tomorrow. Thank you both for joining us on this issue.